Premature ovarian insufficiency is a condition in which women go through menopause at an age younger than 40 years. So it may present either with an inability to become pregnant or the cessation of periods, and is usually investigated in a number of ways. So mainly by looking at the levels of various hormones that are involved in regulating the menstrual cycle. So given that with premature ovarian insufficiency, it's the ovaries that aren't working so well, you get low estrogen levels and you get a high LH and FSH level because the negative feedback effect of estrogen is no longer there. There may be other things that lead to irregular periods, so checking the testosterone level to consider things like polycystic ovarian syndrome and thyroid abnormalities can also be helpful. There are a few measures like the antral follicle count and the anti-Müllerian hormone level, which can give an idea of ovarian reserve. To diagnose premature ovarian insufficiency, you need 2 FSH results that are greater than 30, which are taken 4 to 6 weeks apart. I'm going to talk about the management of menopause and menopausal symptoms. So there are a number of non-hormonal agents like alpha agonists and beta blockers which can help manage some of the symptoms of menopause, such as mood disturbance, vaginal dryness, and flushing. But a lot of the time hormone replacement therapy is opted for. So there are a couple of different types. So there's estrogen-only hormone replacement therapy because it's the lack of estrogen which brings about many of these symptoms. The issue with giving unopposed estrogen is that it can lead to increased risk of endometrial cancer. And so estrogen-only options are only given to women who don't have a womb because they've had a hysterectomy for whatever reason. Estrogen can be given with progesterone as a form of HRT because the progesterone essentially reduces the risks associated with estrogen. The good thing about HRT is that it can help manage their vasomotor symptoms, so the flushing and the sweatiness that they experience, that can dramatically improve. It reduces the risk of osteoporosis, and it can also reduce issues like vaginal dryness. The cons are that it's associated with breast cancer. It can also increase the risk of cardiovascular diseases and VTE. So as for the side effects of these HRT medications, I like to think of it as either estrogenic side effects or progestogenic side effects. So the main estrogenic ones are headaches, nausea, and breast tenderness, whereas the main progestogenic side effects are fluid retention and changes in mood.